Hi, Dr. Dilbert. Dr. Dilbert, I think you need to check your the background. I think it's coming upside down. So if
Yeah.
you could go to settings and do it.
Okay. Am I audible correctly?
Yes, you're audible. Yeah.
Okay. And what about sharing my PPT?
Yeah. So once we begin, once I ask you to share, then you can start sharing it. Yeah. So
Okay. Only at that time I should.
yes. So let people join in. I think we have already started with people coming in.
Okay, fine.
Let's wait for some time and then yeah.
Sure, sir. Still, my background is issues. But here it is showing correctly.
It's good now, doctor. Thank you. Thank you. Hi everyone. Good morning. I think we have started to see a lot of people joining in. So good morning to everyone, and we welcome you all. We will wait for some more time. Probably give our audience 1-2 minutes to. So let's wait for another 2-3 minutes. Thank you. We see a lot of numbers increasing as well, and people joining in. So again, a warm welcome and good morning to all of you. We are just waiting for the numbers to go up since it's an open link, so people are joining in. So we'll wait for another 2-3 minutes. Thank you. All right, so another 2 minutes, all of you, and very good morning to all of you who just joined. We start in just one more minute now at 10:05. So we have 1 minute. Welcome everybody for joining in, and a very good morning. All right, so without wasting further time, I think we should begin our sessions. We can let people join in as they're joining the link. Good morning, everyone, again, and a warm welcome to all of you joining us today. Thank you for taking the time to be here as we come together to mark World Hepatitis Day, which was observed on 28th of July. Before we begin, I would like to extend our sincere gratitude to Takaful Emirat for giving us this opportunity. As a trusted partner in managing medical treatments, both in home country and across the world, we deeply value this collaboration, and we are glad to come together on a platform like this to raise awareness on a cause that matters to us all. Together, we are proud to bring you a session that we believe truly matters. Today's topic is one that affects hundreds of millions of people worldwide, yet it remains one of the most misunderstood and under-discussed. Hepatitis is often called a silent disease. Many who carry it don't even know it until years. But here's the encouraging part. It is preventable, it is testable, and in many cases, it is fully treatable and even curable. That's exactly the spirit of our theme today. Let's break it down, prevent, test, and treat. To guide Dr. Dilbar is Assistant Professor of General Medicine at MES Medical College Hospital, Kerala. Holding an MBBS and an MD in general medicine, his area of expertise include infectious diseases, diabetes and metabolic disorders, and general internal medicines. Beyond his clinical work, he's deeply committed to medical education, teaching both undergraduate and postgraduate students, and serving as a faculty member and the session chair across various continuing medical education programs. We are truly fortunate to have his knowledge and insight with us today. So without wasting further time, please join me in welcoming Dr. Mohammed Dilbar. Doctor, the floor is yours. You can start speaking and sharing your screen as and when you're ready. Thank you.
Thank you. Thank you. Thank you, Mr. Ankit, for the warm welcome. Let me share my PPT. I think it's still not warm. Can you please hit the share button on?
Are you able to share, Doctor?
No, the share button is still inactive.
Okay. I'll just quickly ask my team. Team, if you're listening, can you just enable it so the doctor can share the screen? And meanwhile, while we do it, I'll just quickly run through the agenda as well. So Dr. Dil will present based on the important points on the topic. And towards the end of the discussion, we can have a quick question answer round where the audience are welcome to jot down their questions and put it on the chat window. And we'll try to take it up as many as possible. And Dr. Dilbert can answer most of your questions. Okay, Doc, it's all right. What we'll do is I'll just quickly ask my team to share the screen so that we don't waste much of our time. Let me just quickly do that. And then you can just screen and start. I hope it's visible, Doctor, and to our audience as well. I think. Yep.
Yeah, it's
Yeah, I think Doctor, we can start. Yeah, thank you.
so. So, good morning, everyone. It's my pleasure to welcome you all for this World Hepatitis Day related webinar. First of all, I would like to thank Takaful Emirat, Prospera Health, and MES Medical College for this opportunity to mark World Hepatitis Day through this awareness webinar. Today, we'll be discussing a topic on hepatitis, which is highly relevant across the globe, pertaining to personal health and public health. It's just not a medical condition. It's a global pandemic or global public health challenge. By improving awareness, we can contribute to safer patient journeys, better outcomes, and stronger preventive healthcare. Before we begin, I would like to all of you to think of one question. How many cases of hepatitis can actually be prevented? The answer is a significant proportion. Today, we'll explore how awareness, vaccination, timely treatment, early diagnosis, and simple preventive measures can make it possible. So, as it is titled, let's break it down. So, why are we here today? As I mentioned, it's a global issue. Hepatitis affects hundreds of millions of people worldwide, and it is a silent threat. That is, most of us don't even realize we are affected, we are infected until years later. And we have the power that we have highly effective vaccines and some of which have incredible cures available today. So our goal is to spread awareness and stop the stigma, which is eminently available here, and eliminate the virus. Shall we go to the next slide? So as you all may be aware, highlighting the importance of the liver, as I mentioned, as an engine, our engine, which clears the toxins, alcohol, and medicines out of our bloodstream, which also acts like an energy store, which stores vitamins and energy so you can stay active all the day. It also has a defensive action in the form of an immune defender, helps our body to fight off bad infections and viruses. As seen on the image on the right side, it serves fuel, it serves power, it acts as a filter and a storage. Next. So, about our topic, what exactly is hepatitis? Hepa means liver and itis means inflammation. So, the effect of which is when the liver is swollen, it cannot do its superhero jobs we already mentioned, like filtering blood and storing the energy. The cause mainly relies on heavy alcohol or toxins, and the most common reason worldwide is virus infections. Next. So, to some medical terms, as we have some very interesting and aware crowd here, I should mention the difference between acute versus chronic, which is applicable for all medical diseases, most of the medical conditions. To hepatitis also. Acute hepatitis means it is a short-term infection. Acute means short, which lasts a few weeks to few months. And mostly our immune system will fight it off and recover completely. Contrary to that, we have a chronic hepatitis, which is a long-term infection lasting more than 6 months, and the virus stays in the liver silently. It can slowly cause permanent scarring, which is termed as cirrhosis, over many years. Next. What's next? About hepatitis viruses in a nutshell, it is an alphabetic game. A, B, C, D, E. Among this, hepatitis A and E is predominantly spread through contaminated food and water, whereas hepatitis B, C, and D are predominantly through body, blood, and body fluids. And about the preventive measures, we have available vaccines for hepatitis A and B. But unfortunately, we don't have a preventive vaccine for hepatitis C. Whereas hepatitis D had got an additional protection offered by hepatitis B vaccine. About curing, hepatitis A usually heals naturally by its own. And whereas hepatitis B can be manageable for life, but hepatitis C has got good drugs for treatment. Shall we go to next? So initially, we'll discuss the hepatitis A, E, and E viruses togetherly, which are food and water transmitted viruses. Hepatitis A, which is a clearly foodborne disease and which is very common among the public and mostly through uncontaminated food and water. It enters your mouth when you consume something contaminated by the virus and often spreads when an infected person prepares food without adequate precautions like washing their hands properly. And it also can be transmitted when we drink tap water or using some ice made with contaminated water sources. So that is how hepatitis A spreads. Next. So understanding the risks, hepatitis, everyone is vulnerable. It can affect anyone, regardless of our age, background. If you are exposed to virus, it can happen. But we have to identify some high-risk populations, that is, people with underlying liver conditions or frequent exposure to blood or unsafe sexual practices at higher risk. The hidden danger is that the biggest risk is not knowing. That is, asymptomatic carriers can unknowingly spread the viruses to others. Next. So, what can the awareness do? That is, we can spread, make them patients or people know about the warning signs. Listen to our own body. That is, we have got an unexplained fatigue, feeling completely drained, beyond the normal tiredness. It is a usual common sign. Then we may have digestive distress in the form of persistent nausea, vomiting, or sudden loss of appetite, such things. And some patients may have abdominal pain, aching or severe pain, especially on the upper right side where the liver is located. Next. So, what are the warning signs? We have told about the symptoms, early sign. Now, warning signs are the telltale yellow, that is our jaundice. A key symptom where skin and the whites of the eyes turn noticeably yellow, as clearly seen in the pictures present. And some patients usually report urine may appear dark, resembling the color of strong tea or cola. There is a usual misconception that usually the urine appears yellow on jaundice. No, usually when we have jaundice, the urine appears like a strong tea or cola. And the color of the stools may change, like a pale stools. Next. Next. So, regarding hepatitis A, we have got a vaccine for prevention and it has got total recovery. Almost everyone heals fully in a few weeks with rest. And usually it does not cause a chronic disease. Just vigorous hand washing is the best defense. And vaccine, we have a brilliant, safe vaccine, which is highly recommended for children and travelers who are at risk. Next. The hepatitis E is a most common cause of acute viral hepatitis globally, mostly seen in developing regions. The source is just like hepatitis A. It spreads through contaminated drinking water. The cause is usually heals on its own with plenty of rest and hydration. Next. Next. So, where is this poor fellow virus feels danger is in pregnancy, a serious risk. While usually, as mentioned earlier, it is a mild, but in pregnancy, it is incredibly dangerous for pregnant women, causing severe liver failure for the mother, and can even harm the baby. So, pregnant women must ensure their drinking water is boiled or from a safe bottled source. That is the thing to be taken in mind regarding hepatitis E. Next. So, we have discussed about the foodborne viruses. Now, we have to discuss about blood and fluid-borne viruses like B, C, and D. Next. So, hepatitis B can be mentioned as a stealthy invader. How it moves is like it is transmitted through when contacted with infective body fluids like blood, semen, or any other blood fluids. Usually, it may also be passed from mother to baby, where we call it as vertical transmission during birth or via unsafe medical needles or unprotected sex. It is incredibly tough and much more infectious than our retrovirus HIV. Next. So, pertaining to hepatitis B, if a healthy adult catches hepatitis B, their strong immune system fights it off and completely destroys it 95% of the time. And if a newborn catches it, their immune system is too weak and 90% of them will develop a chronic infection. And for the newborn protection, we have got a birth dose. That is, we prevent lifelong illness by giving babies hepatitis B vaccine within 24 hours of birth. Because hepatitis B is a preventable disease and if untreated can cause liver cancer, this vaccine can be termed as an anti-cancer vaccine. And if an adult has chronic hepatitis B, there are pills that can keep the virus entirely asleep and protect the liver. That is the hepatitis B medical shield. Next. About the hepatitis D, which is D for dependent virus. That is, hepatitis D is a broken virus. It cannot infect you unless you already have hepatitis. So the danger is when you have both by hepatitis B and D together, makes the liver sick much faster and harder. But the amazing news is the hepatitis B vaccine, if you have got that, you are automatically protected against D. Next. Next about the hepatitis C. It is famous for causing absolutely zero symptoms or decades. It's spread primarily through sterilized needles, razors, or unstained blood, which is not very common today, because in the past. And if you can see as an adult, there is a very high chance it will become a chronic lifelong infection. Next. That's not audible.
Yes, Doc, yes. I think there's some network issue, but you're audible now. Can you hear me?
Yeah.
Can you see the screen now?
Am I audible right now?
Yes, doctor. Yeah.
Is it clear now?
Yes, we can hear you, doctor. You can continue.
Okay. So pertaining to hepatitis C, there is no vaccine, unfortunately, because the viruses mutate so quickly, we don't have a vaccine for it. But modern science has created pills that can completely cure hepatitis C. And taking a pill once a day for some 8 to 12 weeks cures over 90% of the patients with almost no side effects. Next. Next. So, as we discussed about the introduction of these viruses, now we'll go to the diagnosis and testing so that we can early detect and early treat these diseases. Knowledge is the best defense. Simple blood test like hepatitis diagnosis, the standard blood test at your local clinic. Usually, we look for antibodies. That is the flags your body made to fight the virus. And if it is positive, we'll go for the viral load. A second test, which counts exactly how much virus is in your blood. Next. So, why should we screen situations? Or why should we screen about hepatitis? Hepatitis can be symptom free for years, and screening is the only way to know. So that early detection, better outcomes. Finding the virus early prevents the irreversible liver damage like cirrhosis. And knowing our status or patient status helps prevent unintentional transmission to your loved ones and your dears. Next. Can we go to the next slide?
Yes, Roger. Yes, we can see the screen. I think there's some network issue at your end. So, uh,
Am I audible?
yes, yes, doctor.
Yeah. So, about various methods checking the liver's health. The first and very easily available and very non-invasive method, that is a painless scan of your belly, ultrasound scanning. It will the doctor see if the liver is smooth or swollen. And if any of the cases, we'll go for the fibroscan. This is a special painless scan on your side that measures how stiff the liver is to determine regarding the fibrosis and the inflammation of the liver. And why it matters is stiff liver means there is scarring. So finding out early means we can stop damage. Next.
Doctor, before we proceed to the next settings, you can change because there's a lot of lag in the audio. Doc, can you hear me now? Doc, your video is stuck. Apologies for the inconvenience to everyone who has joined us today. I think there's some network issue. We are trying to get in touch with the doctor back again. Meanwhile, you can just keep your questions ready, and we'll take it up as soon as we finish the presentation.
Right here. Shall I continue?
Yes, Doc. Yes, we can hear you in bits and pieces. If you can speak, then I think we can continue the session. Then, yeah.
Okay. So we'll discuss about
No, Doc, we lost you again. Sorry.
some dietary myths because there are n number of myths. Okay, so let us continue with dietary myth busting. So there are n number of myths related to hepatitis, whether it is related to dietary in hepatitis, whether it is in the treatment related to hepatitis. So, next slide. So the taking patient
Hi, everyone. I think there's a terrible network issue at the doctor's end because it was raining heavily and there's some issue. But we are trying to get him on the voice call. So please bear with us for 1 minute. We truly convenience. And we try to take him on the voice call and then probably we'll be able to hear him better. Just bear with us for 1 more minute. Yeah. Thank you. Yeah, so we are able to get the doctor online. He will be talking to all of us shortly. He's just arranging because it's raining in his location very heavily. So we regret for the inconvenience, but he'll be back in just another few seconds. Yes. So Dr. Dilbar is here with us again. So, Doctor, yes, you can continue.
Okay. So the first one was regarding the fat and oil. The second one is about the avoiding the milk. That is, drinking milk or having dairy worsens the liver swelling or prolong the sickness. But it's not like that. Unless you are lactose intolerant, that means you have some gut problem on having milk earlier. Milk, otherwise, milk is an excellent source of protein, and your liver actually needs high quality protein to regenerate and heal from the disease. So about the sugar cure, that is drinking massive amounts of sugarcane juice or glucose water pushes out jaundice. That's actually a blunder. That is too much sugar puts extra metabolic stress on the liver. And the worst part is sugarcane juice from the street vendors often carries A or E, making you more sick. So better to avoid high sugar, especially sugarcane juices. To the next slide, that is about the coffee. Tea and coffee are stimulants that are strictly prohibited for liver patients. Never, never, never. It's not toxic. And research shows that 2 to 3 cups of black coffee daily is actually highly protective for the liver. And it helps slow down scarring and damage. And about the next one is a very important one, especially in our area, we usually see bland foods only. That is, people, especially from the older generations, and alternative medicine usually tells that you can eat only boiled, tasteless food, especially avoiding salt or spices. That's actually not true. That is, bland diet makes patients lose their appetite and become malnourished. So it is perfectly safe to have a normal quantity of spices and normal salt in the diet. That is so that a tasty, balanced diet which can keep the patient strong. Now, about the general myth busting. So, the another myth is regarding the mosquitoes. Mosquitoes can bite and suck blood, but they can't transmit hepatitis B or C. There is zero scientific evidence for this, as it is evident that virus cannot replicate inside a mosquito's stomach. So it's a myth. Next one, about sharing meals. That is, or I should not hug or share an office or meal with someone who is having hepatitis B or C. Hugging is safe. Hepatitis B or C do not transmit by hugging or sharing food. They spread through specific body fluids and not casual contact, as they're bloodborne. So treat people with compassion and not fear. The next slide. Another myth is herbal detoxes work. Some good ads showing herbal liver detox teas and supplements will clean out virus faster. No, never. Liver will detoxify itself. It is a detoxifying engine. And most of the cases, many unregulated herbal supplements are actually toxic and trigger sudden liver failure in an already sick patient. So avoid herbal detoxes, especially when you are having a liver disease. I feel fine. I don't have yellow eyes and my stomach doesn't hurt. So I definitely don't have hepatitis. It's not like that. Because as we mentioned earlier, hepatitis C is famously asymptomatic for 20 plus years. So the only way to know your status is to ask your doctor for a blood test. If any suspicion arises, or you are at risk, or you are any family members or peers having the same. Next. Next is about living well and prevention. That is protecting our liver every day. There is a golden rule: no alcohol. That is, alcohol and viral hepatitis are a disastrous combination for the liver. It speeds up the damage, and drinking alcohol accelerates the scarring process. And if you're diagnosed with chronic hepatitis, you must stop drinking alcohol entirely to protect your life. To the next slide, we should adopt some everyday safe practices like using only highly reputable parlors that open brand new sterile needles in front of you for tattoos and piercing, and never share razors, nail clippers, or toothbrushes. Even tiny drops of blood can carry the virus. And take special care. Always practice safe sex, especially with new partners. Into the next. About the active prevention strategies. Prevention is an active daily choice to protect yourself and your community. Have open conversation with partners, healthcare providers about the risk and testing. And always stay informed. Keep up to date with the guidelines from the trusted sources like WHO. As we all know, knowledge is power. Next. And about the ultimate shield, the vaccination. Protect our kids. Ensure our children receive all their routine childhood vaccination. And if you're planning for a travel, get the Hep A vaccination before traveling abroad. Brings incredible peace of mind. And adults should ask their doctors if they need catch-up vaccines for hepatitis A or B to check their status. Next. That's about the World Health Organization goal. The global goal is to reduce new hepatitis infection by a massive 90% by the year 2030 and save 65%. That is, we aim to reduce hepatitis-related deaths by 65% simply by getting people tested and cured. Next. So finally, some key takeaways for your family. There are vaccines. You should practice hand washing and safe practices to protect us. And a simple blood test is the only way to know your status. And we can manage Hep B and completely cure hepatitis C. And the most important social part is no stigma. Treat everyone with kindness. You can't catch it from a hug and all. Thank you. Protect your liver, protect your life, and happy to answer any questions regarding the same. And thank you once again, the Kafilamarat, Prospera Health, and MES Medical College for this opportunity. Thank you for all your kind attention and sorry for the fine technical glitches. I will be delighted to answer any questions.
Sure, doctor. Thank you so much. And I'll keep you on my phone on a speaker mode so that the audience can hear you. I'll quickly, since we wasted a bit of time in between because of technical glitch, I'll just check my chat window and see if we have questions. So the audience are encouraged to, ask questions. Yeah. And then the doctor would be able to answer it. I'll give you just 1 or 2 minutes. So we have a question quickly coming from one of the doctors. Doctor, so she asked, should we undergo routine hepatitis screening? I mean, if you can elaborate on that part, what kind of routine hepatitis screening people can undergo to check or to early detect if there is something wrong? Doctor, can you hear me? And we have another question, which I'll just quickly ask. I think, Doctor, give me 1 minute, guys. Please. Okay, so doctor, we have a question from one of the audiences, and she asked, should we undergo routine hepatitis screening, and what kind of screenings do you recommend or are there to early detect? Usually, there is no need for universal screening. The screening is generally advisable for patients who are at high risk, like patients who are having underlying other diseases like liver diseases, diabetes, kidney diseases, cardiac diseases, or any patients having advanced age and young age, and any patients who are having some relatives or fellows together with hepatitis, or any patients with suspicious of contacting patients with hepatitis, like in the form of unprotected sex or sharing razors or any history of having tattoos and piercing from some suspicious senders, etc. There is no need for universal screening. All right, all right. Thank you, doctor. And I'll take another one which says, what is long-term risk of liver cirrhosis or hepatocellular carcinoma even after what we call the cause of the disease? Like if the patient have contracted with hepatitis B or C and have not taken any significant treatment, and it results in hepatocellular carcinoma or cirrhosis, then it is almost irreversible. Sad to say that. So that's why we promote early detection and early testing. All right, all right. And one of the audiences is asking, can hepatitis test be false positive? What is the incubation period, and can it be passed on to partner in that period? Okay. Every test can have false positive, depending on the card test used and depending on the method used, like etc. So any situation where we are suspicious. Yeah, I think we are back now. I think there was again some issue. I hope I'm audible to my audiences. Doctor, are you trying to join back or? Yes, you are. Yeah, Doctor. So I'll just take one more question quickly because I think we are already ahead of 1 hour time. Yes, Doc. Yeah. So our audiences can hear you now. So I'll just take one from Dr. Geeta, who asked, with the increasing prevalence of fatty liver disease, how does the coexistence of fatty liver and chronic viral hepatitis influence the disease progression, treatment decisions, and long-term prognosis? So when we have a fatty liver as well and chronic viral hepatitis, how does that influence the entire, the treatment decisions and long-term prognosis? Of course, that's a very valuable question because in this era of increasing incidence of fatty liver, which can be attributed to our lifestyle, especially the wrong dietary patterns, bad sleep-wake cycle, sedentary lifestyle, the fatty liver is on a very high tsunami-like rise in its incidence. So, as we mentioned earlier, any patient with any disease affecting the liver is at high risk for
getting the hepatitis virus as well as complications of hepatitis virus infections. So, as the doctor rightly said, it is a very high risk factor as a patient with fatty liver, advanced fatty liver, getting infected with viruses, especially hepatitis B and C, because those are the viruses which can cause chronic diseases. So, unlike hepatitis A, which is usually self-limited, won't cause much issues in a patient with fatty liver. But patients getting hepatitis B and C are always on a higher risk side, and they need rigorous follow-up as well as treatment for the same.
Okay.
Am I clear?
Okay. Yeah, doctor. Yeah, thank you. We have more questions, but I think we can take it on the emails probably because we're running out of time as well. So I think we will conclude this. I'll just keep you on call, doctor, so that you're there with us. Yeah. We will send probably a link of questions to you, doctor, to answer because we have a lot of questions coming in from the audiences.
Sure.
Okay, so thank you, Dr. Dilbar, once again for such an insightful session, and you have truly helped us break it down what hepatitis is, how it spreads, and how much it is preventable and treatable at today's day. To everyone who has joined us, thank you for your time. If there's one thing to take home, let it be this: hepatitis is preventable, testable, and many times it's treatable as well. A simple blood test could be the most important step you can take for yourself and your loved ones. And remember, there is no room for stigma. You can't catch it from a hug. Many thanks once again to Takaful Emirat for this opportunity and to our team at Prospera Global for making it possible. So let's carry today's message forward. Protect your liver, protect your life, and thank you all. You will also receive a YouTube link soon, so you can watch the webinar again and share it with your friends and colleagues. We hope we'll be back with another engaging session, so stay tuned. Thank you once again for joining everybody, and have a good weekend. Thank you.